Good morning, everybody. This is Kim McCoy again at Stratus Health. I wasn't able to be on the last call, so it feels like a really long time since we've all been together. It's been just about a month, though, for most of you or some of you. So our session today is going to be focused on structuring teams. So it's going to build on the work that you did last time. Where we talked about the mapping actors and, kind of figuring out who in your community falls into which bucket with respect to, how they participate in the work with you, how you collaborate on population health, who's doing what, and what their kind of different roles are. So this will help you to kind of continue to think about how to engage folks in your community. Jerry Henniker from Stratus Health is going to be the presenter today, and so I'll turn it over to her in a little bit. But to get started, and just so Jerry knows who's on and kind of where you're all from, let's do introductions. So this time we'll do name, role, organization, and then 3 things that you like about spring. And you can repeat things that other people have said too. So don't feel like you have to come up with unique things that you like about spring each time. And I can get us started. So Kim McCoy, I'm a senior program manager. I'm at Stratus Health. And 3 things I like about spring. I just love how fast everything gets green around. So I didn't grow up in Minnesota. I grew up in Cincinnati, Ohio. And it just amazes me every year how quickly stuff gets green once spring starts. I love hearing the birds again. And I love the longer daylight for sure. That's a big one. So I'm just gonna call on people as I see you on my screen. So Carrie, you're up next.
Oh man, is it bad that the first thing that came to my mind is something I don't like about spring? And that is, what I don't like is that everything's so muddy, and then our little dog goes out and gets muddy and brings it into the house. But what I do like, I totally agree with the longer days and the daylight. I feel like I start coming alive again when the spring starts rolling around. I like, maybe that's just the second one, that I actually start feeling better, that I am, coming back to life, that we can get out and do more things instead of being huddled up in our home. And I like seeing you mentioned the birds, but the birds and the animals. So I was on a call with Kim earlier this morning, and a couple of little deer just walked through our yard. So it's nice to see those animals again. Though just 2 days ago, my sister has a little camera outside her house and caught a big bear on her porch.
Wow.
So not all of those animals are the ones that you want to see around your home, but it is still kind of fun to see those.
Got it. Thanks, Carrie. Okay, Jerry.
I too enjoy that we have more hours of daylight. I think that's probably the biggest thing. I also enjoy that the weather is getting warmer, and so when you're outside, you don't have to bundle up quite as much. And then too, I love it when I take the dogs out in the morning, just hearing the birds singing in the warmer weather with the earlier daylight, so it's not dark out when I'm taking the dogs out. So
Thanks, Jerry. And Jerry, do you want to say
I'm so sorry. I'm a program manager at Stratus Health. My apologies. So
that's okay.
Just totally forgot about that.
No problem. Okay, Christy.
Christy Inger. I'm the lead care coordinator, registered nurse for Olivia Hospital and Clinic. The things that I like the most about spring, I would say definitely the plants and the flowers and being able to get out and do some planting. more daylight, definitely the longer days with the warmer weather, and a lot of the birds and the wildlife as well.
Great, thank you. How about Greg and Rachel? You want to go next?
Yep, you're good.
This is Rachel Gisha from Lakeview Hospital in Two Harbors, and I'm from Employee Wellness and Community Coordination. I love spring because our river cracks open. Then we can get our bikes out again. And I truly love when the hummingbirds come back mid-May by my house because it's also my birthday usually. So
Nice.
Perfect. Good morning, everybody. My name is Greg Ruberg, CEO at Lakeview, and I work with Rachel on a lot of different initiatives, but specifically our employee and community health program. Three things for me: birds, number one. Number two, I like when the frogs come out, when you hear them at night when you're sleeping. That's great. It's the sign of what's to come with summer. And I also like the start of the boating season. I do a lot of boating and fishing on Lake Superior. So it's my favorite time of year. And I just wish it would stay like this for about 6 months.
Great. Thanks, Greg. Okay, Ashley.
I am Ashley Arneson. I am the Quality Improvement Advisor here at Sanford Wheaton Medical Center in Wheaton, Minnesota. Three things that I like about spring are, of course, the longer days and warm weather. My husband gets back in the field and we get to start planting and bringing things to life. And all the kids' activities that we get to attend outside, I guess.
okay.
Nice. Thanks, Ashley. Ellie. Are you there, Ellie? You're muted. Okay, let's go to Joanna.
If you're on by phone, I think it's *6.
Oh, yep, Ellie, it looks like you just came off a mute. No, we're still not hearing you. So I wonder, maybe, how about you want to try putting your three things in chat? Joanna, were you able to speak? We can't hear you either, but. Okay, and then it looks like there's somebody on from Swift County Benson.
Yes, hello, that's Holly. I'm Holly Olson. I'm one of the
Hey, Holly.
registered nurses here at the clinic. We're at Swift County Benson Health Services, located in Benson, central Minnesota. Three things I like about spring. Probably the biggest thing is I can just get outside with my kids. We're not locked inside anymore. So that kind of takes all three spots because I have the three kids.
Got it. Nice. Thanks, Holly.
Mm-hmm.
And then let's see. I apologize because I don't have everybody's names down yet. I see Cricky Mott.
That's Sherry Rickamoto.
Sherry.
Hi, I'm Sherry Rickamoto. I'm the RN care manager and clinic supervisor here in Wheaton, Minnesota. And the three things I like about spring are the longer days, getting to see things turn green, and just knowing we have a more fun season ahead of us.
Great. Thanks, Sherry. And I see a 218 phone number, but I'm thinking that might be connected to somebody who's.
Yeah, I think that might be Ellie.
Okay.
But I did see Joanna put into chat. She likes the birds returning, walks by the lake, and the longer days.
Yeah.
And it looks like Ellie is still trying to unmute.
I know.
Can you hear me now?
Yeah.
Go, Ellie.
Okay. I forgot the *6, sorry. So I'm Ellie Morn. I'm the acting quality manager at Cass Lake. The three things that I like about spring is running outside because I hate running on my treadmill. more sunshine, and I don't feel so cooped up in the fresh air.
Nice. Thanks, Ellie. So one of the things that we're gonna hear about and talk about today is coming up with like an organizing statement for the work that you're doing with your coalitions. And coming up with that organizing statement is really about identifying your shared purpose as a group. So if you think about all the answers that you heard, things that people like about spring, what are some of the themes that you would pull out? So if you were trying to kind of develop a statement that encapsulates what we all like about spring, what are some of the common themes that you heard?
Daylight.
Daylight.
Activity.
Yep, activity outside for sure. Yep. Birds and wildlife, a few people mentioned. Not being cooped up.
Things growing.
Yep. For sure. So what we'll talk about in a little bit is, how you take ideas like that and so partly how you come up with them, but also then how you put them together into a statement that describes what your coalition is really about and what you're hoping to achieve, and do that in a way that anybody in the coalition could read it and kind of know who's involved and what your purpose is. So more to come on that. Okay, so the objectives for today are going to be to talk some more about why leadership teams and interdependent structures matter, how to establish the conditions that really allow teams to function effectively. So how do you set up an environment and kind of a structure and support that really allow teams to flourish and do what you want them to do? And then how do you develop that interdependent structure across a coalition? So, where all of the parts of your coalition have a defined role that's relevant to everyone else. So, everybody essentially has a leadership role in the coalition, and you're all dependent on each other for the success of the coalition, which really fosters buy-in and commitment and shared responsibility for achieving goals. Before we dive into that, I just wanted to check and see kind of how things went for the past month. So last time you heard from Janelle Shearer, and she talked about got us started with the conversation about structuring teams, but so focused on, if you remember, but the exercise was called mapping actors. So it's really about understanding kind of who your partners are, who your competition is, where you might have supporting folks. So it's really about exploring kind of who's in your community and what role they play potentially in the work that you're going to be doing. So did you have a chance to kind of practice that or think about it a little bit more? Any questions that you have? Has anybody had a chance to like practice even doing the one-to-ones, which kind of helps with that engaging networks and mapping your actors?
This is Rachel. I was able to complete a few one-to-ones with a couple people within our facility and one person, a community partner type person. I guess I really just thinking back to 2 sessions ago where I really took the suggestion to listen to somebody's story and then do the big ask, but just to remember if it's a no, that's okay.
Yeah.
And I felt a little more empowered to do that. So that's a
Right.
success there and some great conversations.
Oh, good. Thanks, Rachel.
This is Christy from Olivia. I've had the opportunity to do a couple of the one-to-ones with some community partners and kind of mapped out who else that I want to have those discussions with and have a few of them scheduled.
Great. Anybody have questions for Christy or Rachel about how those went? Or other examples that you want to share? I think with the mapping actors exercise, just if you haven't had a chance to do it yet, I think a lot of times, we have ideas in our head about who we think the right partners are for our coalition and or what role we think they play in the community. And it can actually be a really helpful exercise that doesn't have to take a long time to just remind ourselves or to kind of rethink who those different partners are and how they might fit into either being a part of the coalition that we're forming or supporting it. Or, even if some partners can fall into multiple buckets. So they might be competition, but also be able to support you in some way. But to think about kind of the different roles that the organizations in your community play can be, I think, a really helpful exercise for just understanding what resources those organizations can bring to the table and how they can really be helpful to the work. So I encourage you, if you haven't done it yet, to take some time to do that with some of your team members.
Yeah, one other thing I just wanted to add, I know we talked about this in last month's session, but the other thing is that it's a dynamic map. So what it looks like at this point, that's why we use stickies so we can pick it up and move it. So, like Kim was just saying, somebody might be in competition, but if we can move those people again to either this in support of this work or even as part of the actual coalition, like one of the actual active partners, that can be really helpful. And really, I think the end goal is that we get as many people on the team as possible, and everybody working towards the same goal.
Thanks, Carrie. All right. Well, I'm going to hand it over to Jerry now. So here's just a little information about her. She mentioned she's a program manager at Stratus Health. She's done a lot of work with facilities really across the continuum of care, clinics, hospitals, home health, and in particular has focused on chronic disease management in the past 10 years or so, which is, really tied closely to that population health work that we're talking about. So she has some great perspective to bring to this work, and also has done some work around maximizing use of health records and health information technology, which I think is something that we can all learn from and we can always improve upon. Jerry, anything else you would highlight? Whoops.
I think it's all right there.
Yeah.
I think that I am a registered nurse, and actually I just realized it's going to be 35 years next month. So it keeps getting longer and longer.
Well, Jerry, we're happy to have you here. Thanks for joining, and I'll turn it over to you.
Thanks, Kim. And thank you, everyone, for having me here today. I'm really excited about being able to share more information with you about organizing your groups for change. In the last session, you added power to the equation. So how do we engage right people to generate the power to make that change? And in the session today, we're going to focus more on how to leverage the right leaders so you can maximize that power in your coalition. And next slide, please. So there's a number of conditions that you, and I'm sure all of you are aware of this, when you're forming effective teams, there's a number of conditions you want to have in place to help your team be more effective. The first condition we're going to talk about is making sure you have a real team with the right people. And when we're saying that the team needs to be a real team, that means that it needs to be bonded, stable, and interdependent for a common purpose. Everybody needs to be working towards that same purpose, that same goals. Teams that are bonded and stable and interdependent, they hold their members accountable to one another. So everybody is there to work towards that purpose, not just showing up, to take some time out of their day. To be bonded, it means the leaders should be able to know who's all on their team. So the team is made up of members that are meeting regularly. It's the same people meeting. So you should be able to know who your team members are. Members don't come and go frequently. Again, it's that same group that's meeting. And whoever shows up does, if just because somebody shows up and maybe for one meeting, Carrie can't come to a meeting and they send somebody in their place. When we look at that, they're kind of there to gather the information. That doesn't mean they automatically are able to participate in the team. So again, you're having those same people meet together at the same time. That is what helps bond them as a team. Also, when you have a team like this, teams that work best, I know we see sometimes teams of like 20 or 30 people, and a lot of times it's hard to get stuff done the larger the team is. So if you're looking at a highly effective team, usually you're looking at 4 to 7 members on your team. And when we say a team is stable, and we talked a little bit about this in the first point too, that means they're meeting regular and it's the same team members, so that who's going to be there, and you're able to form and know who they are and what skills they bring. It's not a different random group of people who's coming together every time and you spend all your time just reorienting to what you're working on and who the people are. It means that the members stay constant for a long time. And this enables the team members to better know each other and better know how to work together. In this way, they're more fully committed to reaching that team goal and in reaching the shared purpose that we'll talk more about later that they established. Also, lastly, the team needs to be interdependent. So that means the contribution of each person makes a critical success to the team. The members are working closely together. They're exchanging information and resources in order to get the work done. So everybody has a valuable part in getting the work done. And so that's what makes them interdependent. You can't get one thing done if you can't get things done if everybody's not working on that. The second condition we have here is that they have a compelling shared purpose. And we talked a little bit about this when we were doing our icebreaker at the start. So when you're articulating a compelled shared purpose, it addresses the challenges that arise if coalition leaders come with different amounts of powers and resources. So, sometimes in these leadership teams, you might have a CEO and you might have someone who's a program manager like myself, so if you're all coming together to work on the same shared purpose, that's what brings them together, having that compelled shared purpose. The shared purpose suggests that all partners are created equal, and it helps identify the activity that the group will be working on. Again, it's the group that's working on it. It's not just one individual of that team who's working on it. You want to craft a compelling shared purpose at the start so that it's clear and challenging and consequential. And when we're talking about clear, what we mean here is your purpose articulates what the outcomes will look like if they're achieved. So, letting us know that, it's not just the statement, but what it's going to look like for those in your community or your coalition when you achieve that outcome. Again, the clear purpose is going to include what the team is going to do, who is going to be doing it, and what everyone contributes. The challenging purpose, it's something that's both inspiring and thought-provoking. You do want to have it achievable too, but you want to set a high bar, not a low bar. And it requires everyone's best efforts and is possible if everyone contributes. So an example of this, kind of looking at the clear and challenging here. And first, let me talk a little bit about consequential, and then I'll give you an example I think we're all familiar with. So a consequential purpose has a real impact on the lives of others. So it's something that's going to make a difference. Everyone knows why it matters and why it must be addressed right now. So the example I wanted to share is that when President Biden started his first 100 days, he said he was going to give 100 million COVID. We're going to have 100 million COVID vaccines given in the first, 100 days or first 3 months or in the next 3 months. And so when you look at that, that's a clear purpose, or a clear articulating what he wanted to do. 100 million COVID vaccines would be given. It's consequential because it was important that everybody get their COVID vaccines if we're going to beat COVID. And it was challenging. Although I think what we found is, halfway through, they found that they were already at 100 million. So they raised the bar and they raised it to 200 million within the first 3 months. So that's kind of an example here that I think hopefully everybody is kind of familiar with and can kind of relate to on what the shared purpose was of, for our country really, and all the healthcare givers in the country to get those COVID vaccines out. When you're developing a compelling shared purpose, as part of our second challenge here, or part of our second point here, coalition leaders want to make sure that they can influence the coalition members who are participating on a voluntary basis. So again, we have to remember that you want something that's going to keep people engaged and everybody feels it's important to do. Otherwise, you can face or struggle with turnover in your group. Again, a lot of times because people in your coalitions may be working there voluntarily or they're not, getting paid, they're doing it on their own time. So that's why it's really important to have this commitment and this shared person that everybody has, or shared purpose, that everybody has buy-in for, because that makes it something that people are willing to work on, even if maybe it's not part of their everyday job or it's not part of their daily work. It demonstrates that collective buy-in and it gives people ownership to help meet that challenge. And then the third condition of an effective team is one, we're talking about the enabling structures. So an effective team is going to have those structures that enable it to function. You can go back one more. I'm still on the first slide, Kim, sorry. And it enables structures to allow members a multi-stakeholder team. So you're bringing together people in your coalition that are from different teams or different settings. So you want to have those structures in place that help everybody reach that shared direction and develop trust and processes in their teams. Two of the enabling structures we'll talk about here are the interdependent roles and the norms of conduct. So when we're talking about interdependent roles and teamwork, everyone should have roughly an equal share of the work. And we want to base that on everybody brings unique skills and resources to the team. So that's how we want to look at how we're divvying up the work. You want to make sure you understand what are the necessary parts to each team to achieve that shared purpose. So what are the skills that each team member brings to achieve those purposes? The success or failure is not all on one person. It's on the team. The team is working interdependently. So if one person is not getting their work done, it affects the whole team. Again, it's not just on one person's shoulder. So the whole team is working together in a coordinated effort to reach that same goal. And you want to establish roles are also part of what will help you establish effective functioning for your team. So we have roles that are actually part of meetings. That could be like a note taker role, and then also roles that are part of the team, such as a liaison to the hospital staff. So you want to understand what each of your team members' skills, experiences, and resources are to allow the team members to take on roles to which they are best suited. Some examples of some roles we can talk about, again, meeting roles. So again, this is when you're holding a meeting. That could be like your facilitator, your timekeeper, your note taker. And I would just say, hopefully you have enough people on the team. We said like 4 to 7 people, but, really be cognizant of if somebody's facilitating the meeting. I think so many times we also have them be the note taker. Really, those roles should be divided out and not, make the facilitator also do notes, because it's kind of hard to do both. Also, in addition to roles on meetings, we also have roles within the team. So maybe somebody is the liaison or the project coordinator or the data coordinator, or they're the communications person. So you have your team roles and your team meeting roles. A lot of times we spend energy on, you're going to be looking at the teamwork every time your team meets. So spend some energy every time your team meets on that teamwork aspect of it. You want to make sure you're working well together, again, by learning from each other's strengths and keeping each other energized, so that, you're feeling the best about the work you're doing. The team should solve problems. You want to make decisions during meetings, coordinate work, share information, and create structures and opportunities to enable each other to take action. So really, when you're looking at an effective team meeting, it's one where you are, as we said, getting that work done, sharing ideas, doing some brainstorming. We don't want the team meetings just to be reporting out. I think we've all been part of those too, or sometimes that gets a little, if every time you're just reporting out, but you're not getting anything done, it doesn't feel like you're accomplishing your goal. You just make sure that everybody is working together to accomplish that collective goal, and make sure that your team members feel able to communicate when they need assistance. Again, it's part of being a team, and people should feel that if they need help with something, that it's okay to say that. They shouldn't feel afraid to say that. They shouldn't feel like they're working in a silo. And lastly, in especially effective coordinate or coalition leadership teams, members consult with each other also about the challenges they're facing within their own institutions. So if you're working again as a coalition, that you feel free to talk about some of the challenges as you're working on your shared goal to what's happening within your institution. And as you start, every time when you're forming your teams, you want to make sure you operate with norms of conduct. It's especially important to set these up when the teams are first meeting, because people are coming from different institutions, and different institutions have different norms. So you should have explicit operating norms, so that this will help you have the likelihood of better reaching the goal that you're all working with. You can refine the norms as your group meets on a regular basis. And, especially looking at those that are serving you well, and maybe some of the norms that you've established are not serving well. So maybe those are ones that you, as a team, decide you're not going to have anymore. So the norms, they help guide your team behavior. It's also kind of a way to help, you want to look at a way to enforce those rules. It helps your team stay accountable. And you should look at them, again, as being an accountability, not a punishment. One of the things we talk about is when you're establishing a norm, look at it as more of maybe a consequence or a silly consequence versus a punishment. So say a team norm is that we always start on time. And there's probably some groups, the team norm might be that the meeting always starts 5 minutes late, but if the meeting's set for 10 a.m., it starts promptly at 10 a.m. And if someone is late, the consequence could be that they have to share a recipe. So it's not a punishment. It's kind of something that people realize that they're going to notice that they're late, but not going to be punished for it. When we're talking about effective teams, one of the first things I talked about on the previous slide was that the real team has the right people who are bonded, stable, and interdependent. And we're going to talk a little bit more about that real team with the right people. We want to make sure that our team is made up of the right people for the coalition's settings. People often assume that the senior leaders must be at the table to make decisions. And this isn't always the point or always what happens. You might have some, of the senior leaders from some of the facilities or organizations in your coalition, but you might not. You might have key stakeholders. So often when we're forming our coalitions, we don't do a real assessment of an individual's collaborative abilities. So when we're determining the right people, we want to consider members that are part of our coalition leadership teams. We want to make sure they possess enterprise perspective. So again, maybe they're not the CEO, but they have that enterprise perspective. Mean they can lead for the group, not just their home institution. So they're not just focusing on what's going to be best for their institution. They share a collective view of the coalition and what the coalition is addressing. So again, they're looking not just at themselves, but at what's going to work for everyone. They demonstrate high levels of empathy and integrity, and they really look to address the concern of others and act as one of the group. They're not just working for themselves. They have time to devote to the work themselves. And I think this is really a big one. I think people need to understand upfront how much time this is going to take for them. And they need to be able to say whether or not they're going to have that time. It's better to, maybe not have a certain member from your organization on the leadership team if they can't attend any of the meetings. Make sure that it is somebody who can attend those leadership meetings, and people need to feel comfortable with saying that from the get-go. Highly effective teams are also made up of people who have diverse backgrounds. So they come from different ages, identities, ideologies, skills, and opinions. When there's diversity among your team members, it opens up a wider perspective and inspires a more robust conversation during your decision making. And it also pushes your team to be more creative and resourceful in your strategies. So as we said here, it's really important to make sure that, you have the right people there and that your team is bonded, stable, and interdependent for your common purpose. And one of the ways we can do this is just kind of looking at a shared job description for our coalition leaders. And if you want to go to the next slide, Kim. And here we have an example of what a job description for leadership team members might look like. When you're seeking and securing the commitments to participate on your team, share a clear set of expectations about what team member involvement is going to look like for the potential members, so they are able to understand what is expected of from them from the start and whether they are able to give that to the team. Some examples here, we want them to be willing and able to lead on behalf of the whole. We talked a little bit about that on the previous slide, not just on behalf of their own organization. Make sure they can demonstrate commitment to a collective impact, that they're willing to able and hear and consider other person's opinions. So again, just because you have differing opinions doesn't mean you can't still work towards the same goal. In fact, if everybody shared all the same opinions, it'd be pretty boring. We wouldn't get that different variety and diversity that we're looking for. We want to look for people who have conceptual thinking skills and those who can understand complex systems. Here we talk again about the time commitment. Make sure that they can commit sufficient time. Let them know up front how many meetings there's going to be. Are they going to be quarterly meetings? How long the meetings are going to be each time? And are there going to be is there going to be outside work? So people can know that ahead of time. They, can know if they can meet the job description. Also, are these people who can visibly represent the coalition at community engagement events? So are these people that, when we're out talking to the community, that they feel comfortable talking in front of other groups? Can they participate in committees, projects, and alignment activities? And can they identify and engage with additional community members in the coalition work? So are they people who have some skin in the game, as we'd say, so that people can see that they're doing the work because it makes a difference for their organization, because they can relate to it, or for the coalition, I should say. And if they're representing an organization, again, we don't need to have the CEO, but is this a person who can get the CEOs or the leadership for their organization's commitment? Next slide, Kim. So how we've been talking kind of, here about shared purposes, and that's what you want for your leadership team. So how do we get to that shared purpose? When you're developing a shared purpose for a team, it can be a challenging task for two reasons. The team has to be clear about what it is they will be doing together. And then also it can be challenging because it's difficult to write a purpose statement as a team. So many times I think, we hear it's like, oh, I'll write something and the rest of you tell me if this works for you. So we really want this to be a shared purpose, because it's easy to look at something that someone else writes and think, oh yeah, that looks good. But then if you're not getting everybody's opinions in it, there might be parts that are left out. So what is it that the team is actually doing together? So when you're drafting the shared purpose, it's important to imagine the range of activities the teams as leaders will be doing together. So what is the work that they all will be working on together? The figure we see here, it has 4 different kinds of leadership team activities that, leadership teams can undertake. And so we've got them listed here from the least interdependent to the most interdependent. So bottom is least, top is most. At the bottom, or the least, we talk about information and sharing. So it's important for the team members to keep each other informed. So even though it's at the bottom, doesn't mean that it's not important. It is very important that everybody keep each other informed. Information sharing makes individuals more knowledgeable about what is happening, and it helps them to better align for their shared purpose. So that's, even like I said, even though it's the least interdependent, it is still very important. At this stage, teams do not decide on anything. They're not creating anything. They're just finding out about each other. So it's just kind of, as I said, those meetings maybe where people are just reporting out. The second is the consultation. Consultative teams meet to provide advice and consult each other. So they help support each other's works in their areas of responsibility, but the responsibility to act still is on the individual. So again, they're not taking on this responsibility of the whole. They're just, it's more of that consulting and supporting each other. Then there's coordinating. Leadership teams that take on the responsibility for aligning parts of complex activities and making sure that all these parts fit together. That's when you're coordinating your efforts. The timing, sequence, interfaces, and pieces all work together. So we're making sure everything works together to get to that shared purpose. And then the final, or the most interdependent part of your team functioning, is that decision making. So again, you're collectively working, all the team members together. You're having discussions, you're doing evaluations, you're strategizing, and all this is part of that decision making. And it's the most interdependent part or complex part of the activity, because it takes everybody to make those decisions if you're doing it as a team, of course. When leadership teams are too large, remember how we talked at the start that 4 to 7 members is kind of the nice amount to have. It becomes hard. Those teams they're more unbounded. They are probably more likely to have conflict, and it's harder to make decisions when you have too many people. And they tend to devolve into, more of the less interdependent activities, such as information sharing. So we've all been on those teams, as I said, where all it is it's a group of 30 people meeting and reporting out. So really, if you have a coalition teams that's the right size and the coalitions that are really productive, they're able to be dexterous teams. They have their clear purposes. They have multiple commitments from their team members. They generate structures and information, and they foster decision maker, along with providing that support and learning to their team members. Next slide, please. So I think hopefully we've all been part of those dream teams or heard about those dream teams that use the best part of all individuals. And we look at what everybody is good at. So we're using, somebody's sharpness or their creativity or their vision or what it is that they bring to the team. So those teams, they really are cohesive, they have a shared energy, and they have shared values. And we use those skills of the individual members to make your team up into this, dream team, as we said. And a big part of that is writing that clear purpose statement, as we've been talking about. So when you're writing a clear purpose statement, you want to start and in your guide, I think this is on page 37 and 38, but you start with each individual reflects about the team's purpose, and they share those views with each other. And you can use a piece of paper to do this, or also too, as I know we've done that on other exercises, Post-it notes might come in handy when you're trying to next capture the themes that resonate with everybody. So if you use Post-it notes of that, it might be helpful in grouping what those shared themes are and the shared values of the group. Next, you turn these themes over to one individual to shape a purpose. And into that, they, capture what it is that you want to accomplish in using, plain speak or making it easy to understand. And then it's shared with the group, and everybody helps refine the statement so that there's final discussion and approval of the statement. And next slide, Kim. And lastly, I just want to talk about developing interdependent structure between teams. So we've got these leadership teams I've been talking about that have been formed. So how do we make those interdependent structures between the teams? We've got a snowflake here that shows some of our different team structures. We want to make sure we have strategies in place to support the structures. And it's an important characteristic of distributed leadership is you want to be able to connect all the multiple teams that are part of your coalition. These connections help form a stable, bonded, and interdependent teams. Kind of keep using those three words a lot today, I know, but it helps pull together your actors, and it helps the actors from the different teams connect and helps them to organize. And that way they don't, again, feel like they're isolated in silos. Each of the teams has different goals and activities and decision-making functions within your coalition, so that each of the teams plays different roles. So when we're looking at this multi-layer team structure, this allows your coalition teams to achieve the overarching goals by breaking them down into achievable chunks and spreading them across the teams. So you have your leadership teams who is providing the leadership, but then you maybe have a data team who is looking at the data, or an interventions team who is, doing the interventions. But really that's that core leadership team that really helps to define that overall strategy and make the decisions that support the coalition as a whole, and helps those sub teams achieve their aims. The structure that we see here, it also creates multiple points of entry and multiple opportunities to learn and exercise leadership even within those other teams. It allows each team to recruit for and build, and then also it just helps them all be part of that, feel that they're part and a functioning part of the coalitions. And next slide, please, Kim. So now we are going to do our small group practice. And you can just go to the next slide, Kim. So we're going to be writing a shared purpose. And I realize that not everyone is part of a team here today, that they may be working individually. but it's still something if we want to look at when you're working within your group, how to work on forming a shared purpose. So maybe think of your coalition or part of your team and what you're working on. And that we're going to take 10 minutes so everybody can, take 10 minutes to work on their own. And what we like each of you to do then when you're writing the shared purpose is you start by writing what it is that you're doing, or so who is it that's organizing? Is it hospital providers? Is it area aging groups? What is your vision? And then what is it that you're going to achieve? And again, if you want to refer back to pages 37 and 38 in your guidebook, it really breaks it out how to do the shared purpose. Like it says there in your first column, you write down who it is you're recruiting or who you're going to be working with. In the second column, it talks about what the details you think are going to be the motivation for your team. And then the third column is the activities that you're going to do. And then you use those to develop, as you see on the slide here, your shared purpose. We, the organizers, who we are organizing with, and what you're trying to do, by what approach, in order to, and by what specific time. So, I just a simple example and say, like, we, the ABC Collaborative, are going to be organizing with healthcare organizations in our community to reduce readmissions. And then these are some of the different strategies that you could come up with in order to improve healthcare for our patients by June 1st of 2022. I mean, that's just kind of a simple down and dirty one. So it'd be nice. Let's kind of, spend, I think you guys do this at every meeting, but a little reflection about the exercise, about what went well, what was difficult, and did you come away with a new plan or action that was developed as part of this process? And so just as some examples, was it difficult identifying those common themes or shared values? Was it easy to capture those themes into a shared purpose? I know most of you are working alone, but just even thinking about the groups that you're writing this for, anyone want to share any examples of what they came up with, or just reflecting on some things that you found difficult or easy to do? Great.
So this is Rachel. We were going to share what we have so far and look for any feedback you might have. It went well because we're kind of working on this in some other realms already. I think the hardest part was just defining the strategy, but I'll read what we have. Lakeview is organizing with Lake County Public Health and Wilderness Health to collaborate and integrate resources to address the primary needs identified in our CHNA in order to improve health and wellness of Lake County by the end of March 2022.
That sounds good. Can I just, and I swear I was listening, and what was the buy or your strategy? I'm sorry, I missed that.
Well, that was the part that we kind of struggled with, just finding a strategy.
Yeah. Mm-hmm. Okay.
It's still pretty broad.
So the intervention was the hard part.
Yeah.
So I'll share a few thoughts. And again, I would love feedback from you and the entire group. So what Rachel and I have been working on is trying to create a unified strategy for our entire county. So, we have what Lakeview does now with our hospital and 2 clinics across the county and pharmacies. We're trying to pull in our human services and public health departments. And we've done that already. So we're working on a joint vaccine program for the entire county. So everything we do has been in joint with them. And Rachel set up a foot clinic where we have nurses doing the foot clinic, which used to be done by Lake County Public Health. So we're trying to pull in all of Lakeview's resources and all of the county's resources and Wilderness Health, which is another 10 hospital group that we're a member of, so that we've got one approach for the entire county, so that nobody's doing things kind of unilateral. And I think those relationships are being built, based on what Rachel's reported out on. But the strategy or the strategy piece is difficult because it's so broad. I think it's such a large, it's going to take us years to do this well, but our plan now is to put the plan together and then start building on it. So I guess I'd be interested in feedback or from people that know a lot more about this than I do about what's the right way to do this.
And that's, actually, that's a great point, because that's where it's nice when you have more than just the two of you, or I know we had each of you just working on your own, because you can do some of that brainstorming about what are some of the different interventions that you could do. And then that's, when you look at those themes or those commonalities, that's where it can help you do that approach. Any ideas from anyone else on the call for them about some of the different interventions or ideas that they could use as part of their approach for part of this purpose? Because I'll have to admit, I'm not coming up with any right off the top of my head either. And I'm kind of thinking, I know you talked about. Go ahead,
Carrie, this is Kim. So my initial thought is, part of the reason it's hard to come up with a strategy is because the goal is pretty broad, right? I mean, you're talking about your goal is what you want to accomplish is that you want to achieve the goals that were established through the community health needs assessment process. And it sounds like there are multiple kind of almost small projects that you're going to be working on. So vaccination is one, and the foot clinics, might be another one. And then you might have another one related to mental health, or you might have another project related to, infection control, but there's multiple pieces to that set of goals that you're trying to accomplish. So I actually think you guys did a pretty good job, given that you're trying to encapsulate everything into one purpose statement. What I would imagine is that you've probably got different teams of people working on each one of those goals, or that you might be doing those, you might be prioritizing them and doing them in some order. And so you're going to be able to actually come up with a more specific shared purpose related to each one of those. So if you think about the vaccination work in particular as a separate example, you could develop a shared purpose that is probably more detailed and would have a very specific approach that you're using. And you could get really specific about the goal. So you want to vaccinate a certain percentage of the population or of the senior population, or so I think you did a good job for kind of trying to cover everything under one umbrella.
Mm-hmm.
That feedback is helpful. That's exactly what we've done. So we've taken, like, the vaccination clinic has worked right with the county and said, these are the targets or goals we're going to meet together, and here's the specific plan. So this is kind of our overview of brainstorming, which is an absolute mess, but I'll give you an idea of all the things that are going on. But we want this initiative to kind of capture all of it. And then we kind of break out and redo this for each individual initiative underneath with our entire team or our joint team. So Thank you.
So, what you could do is add some, details like you want to achieve the goals of the 2021 Community Health Needs Assessment. And maybe you even could specify the number of goals that are included, just to give a little bit more, kind of indication of what the scope is. Because if you think about this is sort of like your elevator speech. Like, if you're telling somebody else what this team is really intended to do, what you want is a statement that any member of your coalition could kind of spout off and easily explain to somebody else what it is that you're trying to do.
Okay. Thank you.
Anyone else want to, and thank you for sharing that. That was a great example of the work you were doing. Anyone else want to share on something that they were working on for one of their teams? So what their shared purpose might be, or just even any feedback about the exercise itself. What did you find difficult or easy when doing or looking at how you would do this with a larger team?
Sherry and I here in Wheaton went through and did our shared purpose. We said that we thought it was fairly easy to get going. Our shared purpose is that we, the Sanford Wheaton Medical Center, are organizing with Traverse County Public Health and Social Services, the area schools and police department, to bring focus on depression and mental health in the community by having a monthly task force meeting with our stakeholders, and to address at clinic appointments by a screening tool that is age specific in order to identify problem areas in our community and improve resources for our mental health patients, and to improve depression scores in the clinic setting by January of 2022. And that's kind of what we came up with ours.
Nice. I like that. That's a nice example. And again, it sounded like you said it wasn't too hard to do. It kind of flowed because it's something you're already working on.
Yeah.
So if you think, Ashley and Sherry, about trying to develop that purpose statement with those partners that you talked about at the table, how do you think that process might go? Or what do you think might be more challenging?
Time management, of course, is always hard. Sherry, were you going to talk to it? I think I'll.
Oh, that's okay. I'm just going to say, we actually do meet with them on a monthly basis and have been talking about, a year ago it was focused more on, the youth and vaping. That we use like the school surveys, the fact that a lot of them seem depressed. So I think everybody's, in a sense, all on the same page. What's everybody's role in helping and working on this kind of project? So they may not have the goal of, screening so many people, but all in all, we kind of bring it all back together. So I think it's going to go smooth because it already's kind of been part of the process.
Okay.
Anyone else want to share what they worked on?
I can share what I was working on. I'm Holly from Swift County Benson Health Services. The organizers are going to be us here at the clinic, specifically more me. We're going to be organizing with our radiology department, and our goal is to increase the preventative screenings in our facility. We're going to be doing that by completing the accurate care graphs, and it's going to be addressed during the clinic visits. And the goal is to complete early detection for the preventative screenings. And our goal is next year of March of 2022.
So just looking back again, I know you're working on your own on this, but are there parts of it that were easier to decide on, or parts that were more difficult to decide on? And then too, as we just shared with the last group, are there things that when you are sharing this with the group, since you just worked on your own, do you think this is something that others will be able to buy into or actually contribute to and maybe help you refine the shared purpose?
Yeah, definitely. I think once we have, more of the one-on-one visits with other people, other community members, that we'll be able to, they'll bounce ideas off of each other and they'll be able to help us kind of define our goals as well.
So it's something you can use as a start and then as a group work on the shared purpose. Great.
Yes.
Anyone else have anything they want to share about either the exercise itself or if they want to share their shared purpose? Just wondering.
Yeah,
Go ahead,
Sherry,
Kim.
this is Kim. I was just going to say, something else that you'll want to be thinking about kind of as you put these together is, making sure that you have the resources or the capacity to do the work that you're proposing to do. So if we use the example that Holly just shared, with doing more screenings, you want to make sure, right, that the in that case, the hospital or the departments that are involved are actually going to be able to contribute the people or the time or the resources that are needed to get that done, right? So part of making sure that your shared purpose is realistic is assuring that you actually have the resources that you need to be able to do the work.
So again, I know this wasn't probably, in retrospect, the ideal exercise that I picked out for you to do when you don't have your whole team here, but hopefully it's a starting off point for your teams, and that it's something then that you can work on with the rest of your team members. I think what Kim was just sharing too, very important when you have more from your team, more people from your team there. When you're choosing some of those different interventions, you'll know if they're actually something that people have time to do. And so that's what helps you kind of, looking at those themes and those values and then putting that all together for a shared purpose for your whole group. Anyone else have anything they want to share? I know we're getting a little low on time here. But if anybody else wants to share, again, just their thoughts on the process, or how they might use this in the future, or again, if you want to share your shared purpose. I'm going to say, if not, I think that's all I have, and I will turn it back over to Kim.
Yeah, so I think some things to think about next. There are some other tools that are included in the field guide related to structuring your team. So we only touched on, we spent most of our time today on that shared purpose statement, which I think is really key, to getting everybody on the same board and being able to clearly articulate how you're all going to be working together and to what end. But there are some other tools that you can also use if you look in that section of the field guide. So the diagnostic checklist is meant to help you kind of evaluate how current teams that you're already on or that already established are working. So again, making sure that you have the right people in the right roles, that you've got clear expectations. I mean, if you think about, I think kind of one of the hardest things about managing teams, and especially if you've got multiple teams that are all sort of feeding into the same structure, is that part about making sure that the work is evenly distributed, that everybody is committed at the table to doing their part, and that everybody's contributing in the same way. My guess is that all of us could come up with some examples of teams that we're on where the same people volunteer time after time after time. And maybe you are that person who ends up getting a lot of the work. So figuring out how to set really clear expectations at the beginning and to hold people accountable for doing their part of the work, I think is a step that we skip a lot in teams. We just put everything out to whoever volunteers, rather than being more prescriptive and assigning things to people. And so I think that diagnostic checklist and some of the other tools in that section can be helpful for thinking through some of those things. Our next session is going to be on strategizing collectively. So again, we'll send out the video by Friday with the recording of this session, and with the references for the field guide, and so you can get prepared for that next session. The other thing I would just mention is the population health assessment, that readiness assessment that we introduced back at the beginning. Some of you have completed it, some of you have partially completed it, but I just want to make sure you all still have that on your radar. So we'd really like to get a completed assessment back from all of you by the first week of June, because Carrie and I will use the results of that assessment to really inform the population health sessions that will come next. So just so you have a sense of where we're going, we've got 2 more of these community coalition building sessions. We're then going to have a session that is kind of designed to really help all of you identify where you're starting from when it comes to population health management. So we're going to ask you to do some work on, and we'll talk about this more on the next session, but to look at to pull together some of your data, to actually interview some of your staff and maybe patients and families that you work with, and to look at what kind of processes you have in place for managing population health. But we want to help all of you kind of get to a really clear understanding of where you're starting from with population health. And then, we'll use those population health education and learning sessions to help design your action plan for moving forward. So that's where we're headed. Carrie, anything else that you would add or that I missed? Okay, any final questions or comments before we leave for the day? Okay, well, thanks, Jerry, for being here and for sharing the topics for today. Everybody keep working on your shared purpose statement. Reach out to us at any time if you have questions or need help or just want some feedback. We're always happy to do that. Look for an email again from us with next steps on Friday, and we will talk to you again next month, if not before then. Thanks, everyone.